Good afternoon, everyone. You are very welcome to today's webinar. The panel will be delighted to receive any questions you may have. Please use the Q&A feature that is located at the bottom of your PC or laptop screen. If you are using any other digital device today, you will find this feature located in the More option, usually identified with 3 dots. Now, without further ado, I'm going to hand you over to your host for today, Sarah O'Brien. Thank you.
Good morning, everyone, and welcome. You're very welcome to our Making Every Contact Count webinar series. Delighted to have so many of you with us today. This is number 2 in a series of 4 webinars that we are running from April to the year end. And the objective of the webinar series is to increase awareness of the Every Move Counts National Physical Activity and sedentary behaviour guidelines for Ireland, as well as connecting healthcare professionals with information, supports and resources that they can use to promote physical activity as part of their everyday practice. Today, we're putting a focus on or spotlight on our work with partners outside of the HSE, in particular Sport Ireland and the network of 29 local sports partnerships across the country, very much kind of in that kind of signposting how supporting people to be active outside of the health service space. And we're really pleased to have colleagues from Sport Ireland join us today to officially launch the evaluation of the very innovative Physical Activity for Health pilot initiative that's been running for the last 3 years. So I suppose just to get started, I would like to welcome Minister of State at the Department of Health, Deputy Jennifer Murnane O'Connor, to say a few words.
Good morning, everybody, and I'm delighted to have the opportunity to speak to you today. As you all are aware, the promotion of physical activity for health has been a key aim under the Healthy Ireland framework since its introduction in 2013. Ireland's first national physical activity plan was published in 2016, and this was followed last year by the launch of the National Physical Activity Framework, which will guide our efforts out to 2040. This framework will be implemented by a series of 5-year action plans through which we hope to make Ireland the most physically active population in Europe by 2040. Cross-sectoral collaboration has been an essential part of our work. An independent review of the 2016 plan found that development of the cross-sectorial network was one of the key achievements of the plan. Myself and my colleagues in the department are therefore enormously grateful to the many stakeholders who have worked hard to ensure the success of our work in promoting physical activity. Many of those collaborators are here today, and I want to thank you all for your work. The Physical Activity for Health initiatives is a fantastic example of how this collaboration is working in practice. It has been developed by a partnership of Sports Ireland, the HSE and the Sláinte Care and Healthy Ireland programme of my department. However, implementing the initiative has required cooperation and buy-in from a much wider range of stakeholders. I want to recognise the roles played by the local sports partnership, local authorities, parents, support organisations and many others who enabled the implementation on the ground. The evaluation report we are launching today sets out how these partnerships have worked so well together to deliver programmes of physical activity to a section of our population who need it the most. People living with chronic conditions. Since March 2023, we have had 6 physical activity for health officers in place in Limerick, Longford, Mayo, Waterford, Wexford and Wicklow as part of our pilot programme. These officers have a vital role in bridging the gap between the health service and providers of local community programmes. They have a wide range of roles and responsibilities, from engaging with healthcare professionals through recruiting physical activity tutors, sourcing funding and designing physical activity programmes. Today's report shows very clearly how the 6 officers have achieved great results in improving outcomes for people with chronic conditions. It also illustrates how the system is working together to support referrals and the development of the programs and the follow-up support, and to increase awareness of the physical activity pathways which have been developed. But the most important people in all of the work are the people who are committed to helping, those living with chronic conditions. The evaluation report provides us with some important and encouraging data on the outputs and achievements of the programme to date. One of these is the figure of over 4,600 participants who engaged in the programme during the pilot phase. This is a huge number of people who have had the opportunity to take part and who have benefited from physical activity. However, as we know, behind the statistics there are real people living with illnesses. One of the most striking things to come out of the report is the quote from one participant, which I am going to read here in full. "My husband died at the end of September, and I found the isolation and loneliness huge. The only thing that kept me going was the physical exercise and my daily routine because of my condition. I liked the group changing room where people spoke to me. Sometimes it was the only conversation of the day." What an amazing reflection on the importance of the work we are all taking part in here, and what an encouragement for us to strive to do even more. It only remains now for me to thank again all of the people who have worked so hard in developing this programme, and also in drafting and presenting this very important evaluation report. In particular, I want to mention some of the key people involved. The success to date of this programme has been built upon high level and day-to-day commitment from the physical activity and health sectors. From Sport Ireland, Dr. Una May, CEO and Director of Participation, Mary Van Lyshock. From the HSE, Sarah O'Brien, National Lead on the Healthy Eating and Active Living Programme, and Sarah M. O'Brien, National Lead in Chronic Disease Management. Thanks also to everyone from the local sports partnerships, community health partners, the policy stakeholders, the evaluation team, and of course the participants. I look forward to hearing many more accounts over the coming years from the participants as we build on and expand the Physical Activity for Health programme. Thank you.
Thank you so much, Minister Murnane O'Connor, and we really appreciate your support and the support of your department with this with all our work, I suppose. And everyone can really look forward to later on this morning hearing more about the Physical Activity for Health initiative. I suppose first I'm going to take the opportunity to give you a progress update in relation to the Physical Activity for Health care, or physical activity pathways in healthcare model work that we've underway, and then you will hear from my colleague Dr. Blóithín Casey, who's project manager with the Healthy Eating Active Living programme, and also Dan Russell, health promotion and improvement officer in the Dublin Midlands area. So I'll just share some slides there. Hopefully you can all see.
That's perfect, Sarah. Thank you.
Okay, great. I just get to move on. So I suppose just to kind of give us a refresh, the Minister there mentioned the National Physical Activity framework and an action plan which guides the cross-sectoral work across government departments, statutory agencies and the community and voluntary sector to improve population levels of physical activity in Ireland. This work is very much informed by and guided by the International Society for Physical Activity and Health recommendations around the 8 investments that work for increasing population levels of physical activity. As you see in this slide here, healthcare is one of those 8 areas. And for us in the HSE, and at this particular point, our focus is around increasing awareness of the Every Move Counts, the new National Physical Activity and Sedentary Behaviour Guidelines for Ireland, as well as implementing the physical activity pathways in healthcare model. So again, this for those of you who were at our previous webinar in April, you'll be familiar with this, but just to recap, when we speak about the physical activity pathway in healthcare, what we're talking about are a set of steps that an individual healthcare professional can take to encourage people to be more physically active in terms of screening or raising the topic of physical activity, intervening through delivery of a brief intervention, signposting or referring and connecting people with opportunities to be physically active, which will primarily be outside of the health service. And then I suppose the next time they connect with or see the patient or service user, just taking the opportunity to review and follow up. The physical activity pathway in healthcare model itself describes a series of organizational enablers that can support and build the capacity of the healthcare professional to implement the PAF in their clinical practice. So those are things that the HSE as an organization and working with partners and colleagues can do to make it easier for every healthcare professional to promote physical activity in their day-to-day practice. In the model, we have a 5-year action plan. There are a large number of actions within that, but broadly they fall into 5 thematic areas around building knowledge and awareness, providing training for healthcare professionals, supporting integration of physical activity promotion into routine service delivery, looking at the infrastructure that's required, and then looking at the area of funding and standardization of services. So I suppose in terms of that infrastructure, in April, recently we launched the Get Active program in the HSE app, and we were delighted to do that as a culmination of a number of years work, and it's the first a digital first physical activity support program from the HSE. Just to give you a flavour of what we're seeing since then, in the first 2 months of the service being live, we've had 1,700, over 1,700 people sign up to the program. Every one of those will have received their free Get Active pack. And we see in terms of the balance of people coming in, like this program is specifically designed for people who are not active or are low active. We see that the majority of people are in that kind of not active plan space. So they're starting on the orange walking plan with the somewhat active, which would be kind of 1 to 2 days, taking up the blue plan. And we do offer the program in Irish, and so far in the first 2 months, 4 people signed up to have the program delivered to them in Irish. In terms of who is signing up and who's working with us, it's with penetration across the country. Obviously, as you would expect, kind of higher numbers from the more urban areas. But we do see that 71% of those who are engaged with the program are aged in that 36 to 65 age range, which is the audience we wanted to get to, with a view to getting people active and encouraging them to maintain that activity over time to reduce, to improve their health and reduce their risk of chronic disease as they age. And we do see some engagement with the program in the older age groups as well. At the moment, it's predominantly female or women joining the program, but we are going to be working to engage more men on it, and it is being promoted as part of Men's Health Week, which is this week as well. In terms of supporting healthcare professionals to connect people with the program, we do have a flyer that can be ordered free from healthpromotion.ie, and you can just give it to patients or service users, and it is an easy to follow guide for people to support people to sign up to the program. So we're very pleased overall in terms of how that program is going since it was launched. Also, for the last year, we have been working to develop a set of commissioning standards for structured physical activity programs, tier 2 services, and you'll hear about our tiered model of service delivery from Blauhin in a little bit. So those standards have been developed based on evidence and on practice. We've had consultation and feedback with both the health sector and clinician side, but also with the exercise and physical activity community as well. And they're currently published and available through Lennis, the HSE library repository. And also just to remind you, in general, on the HSE website, we continue to have our exercise information and exercise videos there. So that's just a quick update on where we're at with the implementation of the action plan from the physical activity pathways in healthcare model. I'm going to hand over now to Bláithín.
Thank you, Sarah. I'm just going to share my screen. And while I'm sharing my screen, delighted to say, Sarah mentioned we had socials turned on at the minute for the for Men's Health Week in the Get Active programme, and I see we've exceeded 2,000 sign-ups this morning, which is great as well. So over the next 10 minutes, I'm going to give you a very whistle-stop tour on the whole concept and topic of raising the topic of physical activity behaviour change. And this won't be new to most or a lot of you on the call today, the concept of raising the topic and making every contact count, which is the foundational framework for this work. MEC, as we know it, is the opportunity that a healthcare professional can take during routine appointments or consultations where they have patient contact to raise the topic of health behaviours, whether that be the topic of smoking, alcohol, diet, drugs, alcohol, or in this case, physical activity. And that's what we call a brief intervention. The NICE definition is there on the screen, but just to highlight the last part of that definition, that a brief intervention, it is what it says in the tin, typically taking no more than a few minutes. There's lots of evidence for brief advice, brief intervention in primary care and community-based healthcare settings. I just want to draw your attention specifically to the evidence around physical activity brief advice. Firstly, that it's more effective than usual care. So raising the topic of physical activity is more effective than not raising the topic in the consultation. But more interestingly, it's as effective as more intensive interventions. So when we look at the evidence, raising the topic and providing brief advice, not brief intervention or extended brief intervention, is as effective as referral to exercise referral type schemes, which is no surprise that brief advice is also therefore cost effective. There's evidence for its effect in changing physical activity behaviour in the short and medium term. And evidence suggests that for every 12 patients that we raise the topic of physical activity with, that one of those is likely to increase their physical activity. And the opportunity is there. The opportunity is there in the sense of the number of patient contacts that you will have. But the opportunity is also there in terms of the number of patients that may not be currently meeting our national physical activity guidelines. And that is because we know, I'm showing the Healthy Ireland survey data from 2024 here. The Irish Sports Monitor last month published updated data as well, all showing that the majority of the population are not currently meeting the recommended levels of physical activity. So again, that opportunity there to highlight that and discuss activity levels with your patients. And as well, really interestingly and importantly, we know from the Healthy Ireland survey data that when they ask those who are not currently meeting the physical activity guidelines whether they'd like to become more active, they do. So people who aren't currently meeting the guidelines, over 2/3 of them say they'd like to become more active than they currently are. So again, this slide, I suppose, just highlighting, again, if you think about the number of patient contacts that you may have, but also here, this slide showing that the pool of people not currently meeting the national guidelines, that the opportunity to raise the topic is there. And it's important as clinicians and speaking to the healthcare professionals on the webinar today, that we understand this knowledge behaviour gap
So it's not that our patients don't understand or know the benefits of being active. So it's not that we're telling them they need to be active. Patients know that, we all know that, but knowledge doesn't always result in behavior. So just remembering that before we start the conversation, that it's not the patients don't know what to do, it's that they don't do what they know. And that's because behavior change is really, really complex. Why someone doesn't do a behavior, whether that be physical activity or another behavior, is because it's complex, and lots of behavior change models exist to demonstrate that. I'm just showing one on the screen at the minute, which is the COM-B model, that suggests that an individual determinants alone can cause a myriad of reasons why someone doesn't engage in a behavior. So whether that be a person's physical capability at the time, their psychological capability, their motivation, or their physical or social opportunity. And again, before starting the conversation, being aware that this concept of ambivalence is normal. So you might be hesitant to discuss or raise the topic because you might be met with the, I don't want to become more active, or yes, I want to become more active, but I don't have time. The weather's really bad at the minute, which is true for right now as I look at the window here today. But just to be aware that ambivalence is normal, and when you raise the topic, potentially only a small number of people are going to be in that green space of change talk, where if you ask someone would they like to become more active, they respond with, yes, I'd like to become more active, and how can I become more active? It's more likely that you'll get a response of, yes, I'd like to become more active, but I don't know how, or time, or another barrier being mentioned. So just to acknowledge again that is normal, and still appropriate to raise the topic. I don't have time in this presentation to go into the ins and outs of how to raise the topic and the skills that are needed to do that. The MEC foundational e-learning module is a really good starting point for those of you that haven't completed that. MEC uses what's called the 5 A's approach to starting the conversation. So that's asking, advising, assessing, assisting, and arranging. But if you're to take anything away from this presentation, it's even starting with that first A, which is asking. So asking about current physical activity levels. And again, this is likely preaching to converted on the call today, but I just want to highlight in this slide that when you're raising the topic of physical activity, that there is a difference between exercise and physical activity. And for most of our patients and people you'll be raising the topic with, they're probably starting from a point of maybe not doing much activity. So giving advice around meeting the guidelines of 2.5 hours of moderate to vigorous physical activity a week might be quite a reach for them in that moment. But our guidelines also speak to the concept of every move counts, and that any movement of any kind is better than none. And both physical activity and exercise are beneficial. And that advice of replacing time spent sedentary or sitting with any level of activity is good for your health. Again, in starting the conversation, particularly if you're meeting people that are living with a chronic condition, there might be a question around whether it's safe or appropriate to provide physical activity advice. The answer is it is. It's safe for most people to be active. That's highlighted in our chronic conditions guidelines that were published last year. But that's not a new concept. The American College of Sports Medicine in 2015 changed their approach to even exercise clearance. Again, kind of that statement that exercise is great for most people, and most people can exercise and be active without visiting a doctor first. And Sarah referenced our tiered approach to physical activity interventions. Again, I don't have time to go into each of these tiers, but all I want you to take away from this is that when you're providing signposting advice or supporting people on how to be active, that there is a very small percentage of people that need specialist services, or what we call tier 1 services. And for most people, we're signposting into community-based supports, which are the purple tiers in this pyramid here. And I'm just going to finish. Dan is up next. Dan Russell, Health Promotion and Improvement Officer, on his work in developing regional physical activity pathways. I just want to highlight some national resources that we can signpost our patients to. Here, showing two from our colleagues in Sport Ireland. So the local sports partnership contact finder and the Get Ireland active data repository, where you can find spaces and trails and clubs and where to be active in your locality. And I know Sarah plugged these already, but it wouldn't be my job or within my role not to plug again. So I'm going to plug our own HSE exercise pages. We've a library of videos and also our recently launched Get Active program as well. If this short presentation has given you an appetite for learning more on how to start the conversation and learn skills of motivational interviewing, or how to ask open questions, if you'd like to upskill in this space, definitely start with MEC as that foundation. But we also have commissioned a 3-month hybrid short course with the NIPC. We have applications open at the minute with the deadline of the 14th of August. I think a link is going into the chat at the minute. And that course really is all around upskilling, providing confidence to our healthcare professionals around being able to engage in the physical activity behaviour change conversation. It's free. And if you have an interest, definitely check that out. And I'll finish there just with, I suppose, that reminder to start the conversation. The conversations today can change your patients tomorrow. And I'm going to hand over to Dan next.
Thank you, Blaine. So my name is Dan Russell. I'm a Health Promotion and Improvement Officer with Dublin Midlands Health Promotion Team. I'm just sharing my slides now. Just give us 1 second. And I have been asked to present today on a practical resource that was developed in the Kildare area 3 years ago. And it's called the Kildare Pathway to Physical Activity. The information I'm going to share today is very much around how we developed this local initiative and the number of different services that were involved in the overall collaboration. Some of them being internal services and some of them being external services. So just to state that the initiation of the whole program came around through the Chronic Disease Hub and the Chronic Disease Hub management team in St. Mary's in Naas, and the self-management support team who are also based out of the Health Promotion and Improvement Office in Naas. And what happened after some initial meetings, there was a gap in service identified, and what the clinicians were all keen to highlight was that there was a lack of knowledge on structured exercise programs available, outside of a clinical service. And we held a number of working groups and a number of meetings to discuss, how can we improve this, particularly when clients are discharged from secondary care, or if they're advised by their GP, to keep going in an exercise program that they had previously been taking part under supervision of a clinical program. What was also identified was that the XWELL program was extremely successful in the Kildare area, but a number of the clients were being recycled through this 12-week community-based physical activity intervention. And senior management were also wondering, how can we progress these clients who've already maybe taken part in 12 weeks or 24 weeks of a supervised exercise program into non-supervised exercise. So this was the broad basis as to why we felt there was a need to develop our own local pathway in the Kildare area. We have a quotation here, which was used as part of which was used as part of a poster presentation. And the quotation from one of the sorry, my screen is just flicking here, from one of the senior dietitians in St. Mary's in Naas, is a good summary of why the whole program was developed. And she states, as a clinician working with people living with long-term health conditions, we see firsthand the challenges patients face once they leave structured healthcare settings or have been diagnosed with a chronic disease in the community. For patients living with chronic respiratory conditions and type 2 diabetes, resources like the Kildare Pathways to Physical Activity document provide excellent support, signposting, and I think the key word is there is signposting, and a valuable resource in the continuation of our care. So once somebody has been essentially discharged from a clinical setting, there was a real lack of knowledge as to what is available and what is a trusted source available outside in the community. So that led into a lot of research around what we can actually say is a trusted source for physical activity in the community. And how I went about and how the team went about achieving this was, first of all, actually drawing on the knowledge and the skills of the wider health promotion team, particularly those based actually in the Kildare area. There's quite an experienced self-management support team in the Kildare area, so they became involved in a working group. There was a lot of desktop research and research around government publications. There was some Healthy Ireland research carried out. On our own HSE website, there's actually some excellent links and resources around trusted sources towards physical activity. As part of this overall presentation, you've heard Sarah mention about the positive relationship with the local sports partnerships, and Kildare Local Sports Partnership and Kildare County Council became involved, and they supported and contributed to supplying information on their resources in the community that they felt that signposting could be used towards. We also had at senior management level, they consulted with primary care managers, primary care network managers, and the National Healthy Eating Active Living team. And then we also looked at, existing service level agreement and grant aid agreement partners who may be providing physical activity services in the community. And then we also had the start of a new MEC directory, which had some valuable information in it as well. So all of these sources were reviewed, and what happened was we actually contacted, offhand, I can't remember the exact numbers. I think we contacted about 35 different partners, and we got permission to include about 25 different resources as part of the Kildare Physical Activity Pathways. The pathway itself, the clinicians wanted printed hard copy versions of it. We also decided to develop some kind of an electronic version. So you'll see the QR code in the top right-hand corner. The QR code was used on the Bitly platform and developed on the Bitly platform, which can be monitored and can be measured every 30, 60, 90 days. And it's been in existence now for 2.5 years. We also wanted the pathway document to be available so it could be shared very easily on a WhatsApp or on an email. And we decided to use the Publu platform. And we uploaded the document onto Publu. So when members of the public or when a clinician opens the document, it actually reads like a book. We also used the Bitly platform to develop what they call a halfback name and a live Bitly link. So it's quite easy to identify there. You will see bit.ly/Kildare Pathways to Physical Activity. So we felt that this was very useful in identifying the exact document. And you can actually, depending on which kind of, I suppose, depending on how much money you're paying to Bitly, there's various different ways in which you can actually measure this, and different accounts available on the Bitly program. The Dublin and Midlands Health and Wellbeing team also have a bit.ly link to our web hosting service, which is a Padlet page. And this Padlet page contains various amounts of documents on all the services available through Dublin and Midlands Health Promotion. And we also have the Kildare Pathways to Physical Activity hosted on this Padlet page. If I was to make one improvement on what we have done over the last couple of years, it would be to upgrade the bit.ly platform, maybe get a little bit of a more expensive or a kind of an improved hosting platform, because unfortunately there's so many people using bit.ly at the same time that information can get lost or QR codes can get mixed up, and bit.ly links, can be changed very, very easily. So that's something we're going to look at in the future. And progression. The Kildare Pathways to Physical Activity has been in circulation now for about 2 years. The general feedback on it is extremely positive. And what we have actually done in the last 12 months is we have developed a Dublin Southwest pathway to physical activity. And just recently, we have also completed a Dublin South City and West pathway to physical activity, with very, very, I suppose, specific links to the general geographical IHA areas of each of them, but they also include quite general links to the wider HSE and Healthy Ireland exercise programs and to the Every Move Counts program. And that is a very quick summary of our Kildare Pathway to Physical Activity. Thank you.
Great. Thank you. Thank you so much, Dan. And I suppose just both Blóithín's presentation and Dan's kind of bring to life the work that can be done to support healthcare professionals to integrate physical activity promotion into their everyday practice, because it's kind of unrealistic to expect health professionals to do all that work of kind of looking around and seeing what's available, but the work of Dan and colleagues makes that so much easier. So we just are going to now have a short video for you. Definitely please get up and move around while the video is playing, and then we'll be back.
This is your warm-up. To begin, we're going to start with some arm circles. You can bring your arms out to the side. We're going to do 12 of each exercise. So starting small, we're going to make some circles going forwards. 2, 3, getting bigger now. 4, 5, 6, as big as you can. 7, 8, 9, 10, 11, and 12. Okay, we're going to go backwards this time for 12 again, starting small, gradually getting bigger. So 1, 2, 3, 4, 5, getting bigger, 6, 7, 8, 9, 10, 11, and last one, 12. Okay, next we're going to do some marching. So we're going to do 12 of these as well. So we're going to start off, we're going to do 1, 2, 3, 4, 5, and 6. If you'd like to make it a little bit harder, you can add in some knee taps now. So 1, 2, 3, 4, 5, and 6. Now, that is the marching finished. Okay, next we're going to do standing twist and punch. You can bring your hands out in front of you. I'm going to do a little demonstration first. So I'm going to go opposite arm, opposite side, opposite arm, opposite side, twisting your core as you do this. Now we're going to do 12. Okay, so let's begin. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. Okay, and our last warm-up exercise, we're going to be grabbing a chair. We're going to do the sit to stand. So grab a chair behind you. Place the 2 feet about hip width apart. You're going to have the hands coming across the chest like this. We're going to start off now. We're going to do 12 of these. So sitting down into the chair, and then we're going to rise up again, keeping the head and shoulders looking straight ahead. So that's 2 and 3 and 4 and 5. Keep looking straight ahead. And 6 and 7 and 8 and 9. Couple more now. And 10 and 11. And then last one, we're going to finish off on 12. And well done, that's your warm-up complete.
Great. I hope you all enjoyed that little warm-up there. And that is Susan Potter, who is one of the exercise instructors as part of our Get Active program. And the routine she took you through there is part of the warm-up. So you should all be well awake now and refreshed again. So welcome back, and we're delighted now at this point to be joined by Dr. Una Maid, CEO of Sport Ireland, and Eamon Leahy from S3 Solutions, who are going to share further information on the Physical Activity for Health initiative and the evaluation. And then following Una and Eamon, Colin O'Hare from the Department of Health is going to chair a panel discussion for us. So over to you, Una.
Thanks very much, Sarah. I must admit I'm raring to go now. Just sitting down after doing the warm-up seems a bit of a sin, but anyway, I'll follow it up later, I assure you. So look, first of all, I just want to thank everybody for making this initiative a success, and that's all the partners, all the stakeholders we've worked with, yourselves, but more importantly, from my point of view, is my own team, who've done a phenomenal job of working very closely with the LSPs to make this work. And Sarah, you and I recognise this big area of need and this gap in the, I suppose, the capacity of the sector to deliver for people with chronic conditions. And many years ago, you and I had conversations about what we need to do about this. And it's really fantastic to see it come to fruition at this point in time. So Sport Ireland is very pleased to be part of it and very pleased to be working with all the key partners, because really what we do in Sport Ireland, our goal is to ensure that everyone, and I mean everyone, regardless of what their conditions and what their abilities or disabilities, ensure that everyone can experience the lifelong benefits of sport and physical activity. And that involves working together. And our main ways of working are through collaboration. And we have a very strong focus on evidence-led decision-making, which is why I'm very pleased to be here today for the official launch of the evaluation of the Physical Activity for Health programme. And I know you'll hear from some of the team around the details of that. But from Sport Ireland's point of view, although this programme has only been in place for just over 2 years, we've already engaged with over 4,500 participants across 6 counties in the pilot. We've delivered over 250 tailored programmes. We've trained 68 specialised tutors, and we've engaged very closely with 161 healthcare professionals. And it's the engagement with the community and with the healthcare professionals that has really seen the ability to actually scale this up, and the future, we hope, for the programme. Some of the key, I suppose, high-level points to note from the evaluation relate to the evolution of the programme from the early days, where raising awareness was really the key to actually the success of the programme. And I know that's been raised a number of times already, and Dan in particular mentioned the fact that it's a challenge is for people to become aware of what's available to them, and people engage with the programme and sometimes they don't know where to go next. So that's a really important part of this for us. But the whole concept, as Dan mentioned, about the trusted source is really very important to us as well. And the building of relationships is what was the second phase of the success of this model. So once we have raised awareness, it's about building the trust of the communities that we would like to avail of the opportunities, but also the healthcare professionals like yourselves that we really want to work very closely with, and that there is that level of trust that when we run a programme, that it is a trusted source, and that healthcare professionals can feel confident that they're advising people to go to the right kind of source of activity. And I know that from the evaluation, and the team will share, as I said, more detail, but what's really key is that the outcomes, apart from the physical activity outcomes, which is exactly what we were trying to achieve, we know more people are active, we know there are less inactive people, and that's one of the most difficult groups to actually I suppose, successfully activate, is those who are already not in any way active. Getting people who are active more active tends to be an easier job. But coming alongside all those are the kind of anecdotal evidence we have around the instilling of confidence, the improvements in health and mental well-being, and the social connection. And the Minister previously made reference to the importance of the social connection, and that's something that we just can't really say enough about. From our point of view, our role is around sport and physical activity, but the benefits to people's health and well-being of being active in sport or physical activity in general are absolutely enormous. And the key thing, as I made reference to already about the building awareness and the trusted relationship, is the importance of signposting and improving access to these programs. So as the sports partnerships, we can continue to develop and deliver programs, which we have done and we do across the 29 sports partnership. It's making sure that people are signposted to these programs and have the confidence to actually take part in what we're offering them and understand what's available to them. So this particular initiative is really, really important from that point of view. It does make that very strong connection. I talked about the importance of evidence, and we work very closely with our team in here, our research team, around, we have developed a measure for physical activity called the M1, which is really a single item question as to, are you active? Are you active more now than you were before? And we ask it at certain intervals. So we have the information. So we know these programs are effective, and we just need to continue to support them. So look, I just really take the opportunity to thank everybody involved, and that's the partners and stakeholders who've worked with us to actually make this initiative a success, but also the 161 healthcare professionals we've worked very closely with and engaged with through this initiative, and all of you who've made the time to actually attend today to learn more about what's going on in this area and how we can benefit the communities we serve and the participants we'd like to see being more active. So thank you to everybody. I'm just going to hand over now, and we have a video message from the Minister for Culture, Communications and Sport, Mr. Patrick O'Donovan. So thank you very much.
Hello everybody, I'm delighted to join you for the launch of Sport Ireland's Physical Activity for Health report. As a government, we have an ambitious goal to make Ireland the fittest nation in Europe by 2040. But ultimately, this is about people and improving our everyday lives. We all know that being active has huge benefits. It supports our physical health, helps our mental well-being, reduces the risk of illness, and keeps people connected and engaged in their communities. The good news is that more people than ever are getting involved in sport and physical activity, but we also know that there's more to do, especially in supporting people living with chronic conditions. That's why initiatives like Physical Activity for Health are so important. Through the local sports partnerships, including Limerick, dedicated officers are helping people across programmes and opportunities that can genuinely improve the quality of life for all of us. We're already seeing real results with people feeling healthier, fitter and more connected. That's hugely encouraging, and I hope we can continue to build on this success right across the country. Thank you for joining today, and thank you for everyone that has been involved in making this initiative such a major success.
Good afternoon, everyone. Just share my screen. Good afternoon, everyone. Delighted to be here. My name is Eamon Sadak. I'm one of the co-founders and directors at S3 Solutions. Our team had the privilege of working as the evaluation partner for the Physical Activity for Health pilot program. So over the next few minutes, I want to share some of the key findings from the evaluation, focusing on the delivery model that emerged, the key achievements from the pilot, the outcomes that were achieved, and some considerations for future development. One of the most important findings from the evaluation was the emergence of a clear 6-stage physical activity for health delivery model. So across all of the 6 pilot areas, a clear and consistent approach began to emerge organically through the pilot. This typically began with raising awareness and building relationships between the 6 physical activity for health officers and healthcare professionals, which required kind of sustained effort and persistence. But over time, those relationships created confidence in the quality and safety of community provision provided by LSPs, and in particular, increased awareness amongst healthcare professionals regarding the quality of the tutors, the quality of the programs, and the accessible way in which LSPs create and deliver opportunities for people in their communities. This in turn then led to increased signposting into programs, greater participation amongst people living with chronic conditions, and ultimately improved outcomes for people living with chronic conditions. What's important about the model, and it's a process-based finding, is that it demonstrates the really important role of the physical activity for health officer as a bridge between healthcare services and community provision within LSPs. And it helped to consistently connect the two systems that have traditionally operated separately, or at least in a more sporadic way than they have done through this pilot. So crucially, the model now offers a practical framework upon which any future expansion or further development of a program like this can evolve, and a clear understanding of where time, energy, and effort are need to be focused in order to achieve success in a future program, or if other officers were to become involved. So I think, and as mentioned, some of this in terms of the scale of delivery through the pilot, which has been substantial. Across the 6 counties, we know there's been 253 unique programs or initiatives developed, 68 specially trained tutors who facilitate and deliver the programs, and 161 healthcare professionals engaged, with more than 4,500 individual people engaged in those programs. But perhaps most importantly, approximately 27% of those participants were signposted to programs by healthcare professionals. And whilst baseline information was not available across every area, in some LSPs it's estimated that prior to the program, around 8% of participants might have come from signposting from healthcare professionals. But all of the LSPs involved have identified this consistently as one of the most significant achievements of the pilot. It offers evidence that stronger pathways are beginning to emerge between healthcare and community settings. And I think together, these figures demonstrate the reach of the programme and its growing integration within local health systems. So for a pilot programme like this, it's really important to identify what success means for the stakeholders that are materially impacted by the programme. In this case, that means partner organisations such as healthcare professionals and LSPs, i.e. within the system, but most importantly for people living with chronic conditions. And during the pilot, the HSE, Sport Ireland and LSPs agreed on a prospective logic model for the programme, which sets out clearly the causal link between the stuff that's done by the physical activity for health officers and the programme, and the changes that the programme intends to create, both short-term and medium-term. And it was agreed that success for this pilot would represent progress against the short-term outcomes in particular, and that was a reasonable expectation and a reasonable measure of success. So the logic model that was developed therefore provided an underpinning frame against which the evaluation was carried out. Now, for partners and stakeholders, there was strong evidence across all of the short-term outcomes in terms of progress. The programme increased awareness of community-based physical activity opportunities. It strengthened relationships and partnerships between healthcare professionals and local sports partnerships. It increased community delivery capacity in terms of those tutors that were trained, and it significantly improved confidence to signpost participants into appropriate programmes, as is demonstrated by the 27% figure. There was also, encouragingly, emerging evidence of progress against several of the medium-term outcomes, particularly around more effective and efficient signposting pathways through the use of digital systems, and the potential for sustained delivery capacity in terms of having tutors trained up that can contribute to programs on an ongoing basis. And there's also emerging evidence around the potential for programs like this to reduce pressure on healthcare services through increased participation in physical activity. And we'll hear about that specifically from a participant in a video shortly. So the findings demonstrate clear progress towards the agreed success measures for the partners and stakeholders involved in the programme. For people living with chronic conditions, the findings were equally positive. So the key story here is around greater participation, stronger social connection, and increased confidence. So there was very strong evidence emerging of increased awareness of the benefits of physical activity, improved confidence and motivation to take part in programs, significantly improved social connectedness generated by attending and engaging in the programs, and increased independent participation beyond the organised sessions where participants were actually seeking out other opportunities within their community. During the evaluation, we were able to draw on data from Sport Ireland for 181 of the participants who completed pre and post surveys using the M1 physical activity measure. This recorded a 7% reduction in inactivity and a 13% increase in the proportion of participants classified as physically active, which represents significant improvements within the programme. And there's also really encouraging evidence beginning to emerge around sustained participation in sport and physical activity and longer sort of self-management of chronic conditions, whilst participants consistently described improved well-being, both physical and mental, that stronger social connectedness and greater confidence in managing their own health through physical activity. So there's a couple of quotations on the slide in front of you that for me capture the essence of what we heard through the evaluation. And from a healthcare perspective, the quote really reinforces the physical activity for health officer as a critical point of connectivity between systems, creating greater coordination and helping to drive consistency in terms of the signposting and access to programs within a community. From the local sports partnership perspective, the programme was described in many ways as transformational in terms of how they've engaged with healthcare services and the strength of the relationships that have been developed during the programme. I'm conscious that both these quotes represent partners and organisations. You'll shortly see a brief video from participants that talks about the impact and benefits from them, and they describe it in a much more powerful and impactful way than I ever could. So the evaluation makes 7 key recommendations, but they can broadly be grouped in 4 themes. Firstly, strengthening signposting systems through more efficient processes and stronger feedback loops was identified as a key priority. Using digital means to improve the effectiveness of signposting was also referenced. Second, and an important one around moving beyond personal relationships to try and embed partnerships through more formal agreements like service level agreements and MOUs. And there were some really positive examples of that emerging during the pilot process. These set out shared responsibilities, shared resources, and expectations of partners, but importantly, they help to sustain relationships whenever an individual person moves on to a new role and the risk that those relationships are lost and progress is lost. So that's sustaining the partnerships is a key recommendation. Thirdly, around administration. So really this is about increasing the administrative capacity to support participant engagement. And we heard consistently that whenever there was a follow-up phone call or hand-holding for participants to overcome those initial barriers to engage, it significantly increased confidence and motivation and engagement itself. There's also a huge administrative task for the physical activity for health officers in terms of data collection and follow-up to evidence the impact of programs like this. So increasing the administrative capacity of programs will go a long way to improving and sustaining outcomes. And finally, building on what's been learned by embedding the delivery model. If the program was to expand, it offers a clear pathway for new PAFOs and for healthcare professionals. Promoting shared learning across the physical activity for health network was a key benefit, and building on that network and relationship would be important, as well as exploring opportunities for alignment in terms of national branding and ensuring that the programme continues to align closely with some of the local, regional and national initiatives that we've heard about earlier today. So in conclusion, the pilot has established a really strong foundation for physical activity for health in Ireland. It's strengthened relationships between healthcare and community services. It's increased participation opportunities for people living with chronic conditions and demonstrated meaningful benefits for those participants. And importantly, there's now a practical and scalable model that could support the future development of the programme. Of course, I would encourage you all to check out the full evaluation report for a more in-depth overview of findings. But thank you for your time and thanks for listening today.
2010 I got breast cancer. The chemotherapy package that I was on has damaged an awful lot of my bones. I just find that it's brilliant for me. This is like pain-free training. Makes me feel good. When I get out of the water, I can walk better. And that's a huge thing. 3 years ago, I was on 2 walking sticks. So now I'm down to no walking sticks.
3 years ago I was diagnosed with bad respiratory and I needed the oxygen. I'd never done any exercise, I'd never done anything much. I always said, no, I can't. But I mean, you know, it was so different. But it really opened up everything for me. and it was the best thing I ever did, basically. My respiratory man, Dr. Castley, I mean, he has my appointments now once a year instead of once every 6 months, and he said it's definitely due to the exercise, so he's very happy.
In our pulmonary rehabilitation service, people post-admission to hospital or post-exacerbation, people with COPD, we can help them rehabilitate back and improve their lung function and capacity. People are surprised with themselves how much further they can walk, how much further they can do their shopping, they can live their lives better, and I suppose it's to continue that building of strength and lung capacity. That's really where our links come in with the Limerick Sports Partnership and the Physical Activity for Health programme.
Good afternoon, everybody. Colin O'Hare, Physical Activity Policy Lead in the Department of Health. And for this section of the webinar, I'm joined by my colleagues Sarah O'Brien in the HSE and Benny Cullen in Sport Ireland. Thanks, both of you. As my minister touched on earlier, I think that, today's webinar really talks to cross-sectoral collaboration. And I suppose, having that range of different participants here really kind of brings that to life. I might take the opportunity, I suppose, to kind of start out this initiative, the Physical Activity for Health initiative, came about shortly before I came into the role. And I'd be curious if both of you could give your sense of how it came about. I understand that it began as an idea sparked during a HEPA conference or an ISB and PA conference in 2019 or so back in Denmark, and was developed then. It was kind of teased out here in Ireland. So I might start with you, Benny, and then maybe Sarah, just get your thoughts on, I guess, how we got to where we are. Thanks.
Thanks, Colin. Great to be here. Really nice to see this initiative and program reach the milestone that it's reached. And yeah, I mean, Sarah can chime in and maybe correct my memory, but I think it was around 2019. I think it was a HEPA conference. It was in Denmark. Sarah and I think we must have attended the same talk. And then after that talk, we were in a hallway and we sat down at a table, and I have a feeling we drew a picture, and we kind of had clinical healthcare on one side and community sport and physical activity on the other side. And we just drew this kind of gorge. And we were like, how do we bridge this? So the people who are in clinical healthcare trying to get back into facilities can make that connection into community settings. And we imagined this bridge, and we thought, okay, what would that bridge be made of? And that I think was the initiation of okay, how would we go about improving the system? And then when we came home, credit to Sarah, she did a lot of thinking, I think, on her end, from the clinical HSE side. And I remember at one stage we had a meeting with, I think it was Laura McGahey and Una, who you heard from earlier on, to kind of figure out, okay, from a senior level, what does this look like? How could we build something out of this? And I might pass on to Sarah, because I think I actually moved unit in Sport Ireland. So I was involved in the early stages, and then some of my colleagues got more involved, and Sarah probably carried through to fruition then, which is where the real work was, I'd imagine.
Yeah, no, it was that conference in Denmark, Benny, and I suppose I had been coming up to that time, and you were in the participation unit at the time in Sport Ireland, and talking to yourself, and Emma Jane was your other colleague who was there at the time. And talking to my own colleagues in the HSE, we would have been, and in health promotion, I suppose, in particular around the regions. We're very aware of the Sports Inclusion Disability Officer initiative that you had over a number of years, and then had expanded fully across the LSP network. And in conversations with my colleagues, it was always there was always this kind of tension around inclusion. What do we mean by inclusion? And for that program, you have a very clear criteria around who it focuses on, what the funding is for, and whatever. And a lot of my colleagues would have been trying to kind of fit in a square peg into a round hole. What about the people in health services with chronic conditions? They need to be included as well. And I think it was actually the UK Sport England had done some work around that connecting physical activity and sport and health space as well, that prompted our conversation. So it was really great then when we came back to be able to continue those conversations. It was really great to have the I suppose the openness in Sport Ireland itself to consider this, and to kind of think about this kind of stepping into maybe a space that people felt maybe wasn't where sport and community sport should be moving. And equally, there was a lot of really forward-thinking people in the local sports partnerships who were already engaged in some of this work as well. So, in some ways, it was pushing an open door, and then it was fantastic to get the support from the Department of Health to fund the posts in through Sport Ireland. And it was great for us then also to be, so while the initiative is a Sport Ireland initiative, it's funded from the Department of Health into Sport Ireland. Sport Ireland have the ownership and the governance around it. But, it was really great because we were part of the conversations, able to, influence the criteria for selecting areas, and the work further on. So at the same time, we were working with the Department of Health around this Sláintecare Healthy Communities initiative, which the minister referenced. So, the Healthy Communities Initiative there was 18 sites initially. Now it's up to 24. Kind of mapping didn't map really well with the PAFO initiative, but with Sport Ireland, we were able to say, well, actually, one of the critical criteria for the looking at the expressions of interest is that there will be a Sláintecare Healthy Communities area in the LSP geography. So that helped with that kind of connecting up those two initiatives, and also ensuring that there was that it was meeting objectives from a HSE side and a Sport Ireland side. And I suppose that's been one of the key pieces. So as much as the physical activity for health officers on the ground in the local sports partnerships do a lot of working across and talking to health stakeholders, whether it's our health promotion officers, whether it's our health promotion officers that are based in the chronic disease hubs, or operational officers, or clinicians themselves, throughout the last 3 years, there's been a very strong ongoing communication and conversations between ourselves, myself and Bláithín in the national team, and Colleen and Neil, and that in Sport Ireland, who kind of support the LSPs around it. And it's really important to have that two-way or two layers of communication, and just also to ensure that like our communication across nationally and regionally in both Sport Ireland and the HSE is consistent, because we all know the challenge with Chinese whispers.
That's a good point. No, I mean, to a certain extent, I could really just sit back and watch the two of you talk through this, because you're both so passionate about it. And, I think where we're at now, it's very much feels like those great ideas where you're immediately, once you see it, you're like, why wasn't that there before? But I think, Sarah, you touched on, I suppose, the awareness at LSP level, and I suppose those local connections. And obviously, Una May spoke earlier about, I guess the importance to Sport Ireland in general on this. And certainly from the Department of Health perspective, we I don't know if we express our gratitude often enough for that level of support. But in terms, Benny, I suppose, of at that stage where this got going, and I guess getting that senior level support and building a strategic process that enables those kind of engagements at LSP level, where people, it's integrated into the system. Would you have a sense, like, I mean, how did that sales pitch go, or at a senior level, where do you see that in Sport Ireland? Thanks.
Yeah, it's so. I think to some regards, Sport Ireland, the NGBs, and I think especially local sports partnerships, are kind of victims of their own success to a degree, right? They've scaled quite significantly over the last 20 years, certainly over the last decade. The Sport Ireland and the funded bodies, those LSPs and NGBs, have consolidated the evidence base and the evidence-based decision making through which they make policy decisions and investments. And the work that we do is appreciated by other government departments. I think the benefits, the health benefits, physical, mental health benefits of regular sports participation, regular physical activity, are well established and highly regarded by government. And so now government's seeking ways by which they can get more people in the population to access these benefits. And local sports partnerships, NGBs, are seen as a mechanism by which that could be activated. The challenge, and you're right, there is a bit of tension there, Colin, because effectively, and I'll focus on the LSPs. I mean, LSPs at the outset were established to increase sports participation rates, support the development of local clubs and coach education, try and tackle some of the participation gradients we have around socioeconomic demographics, women in sport, people with a disability. They weren't really established to have this engagement with a clinical setting within the health sector. And so that was a journey. And there was already some programs, Sarah mentioned, where some LSPs were leaning more into that space and less into that space. And from the LSP's perspective, it was sometimes coming at the cost of some of the other work that needed to be done, right? So it was nice stuff to do and really important stuff to do, but there were other, nice and important things to do as well. And so I think that's where that collaboration that emerged between the HSE and Sport Ireland. And it took time, and it was very considered and very strategic. With senior level buy-in, a lot of thought in the executive as to how we would structure this, but to resource that piece of the work, that before was kind of happening ad hoc, but wasn't resourced. I think if you read the evaluation report, like some of the quotes there within the report, and even the process that Eamon outlined there that LSPs had to go through, it kind of consolidated, ad hoc, behaviour that was happening from time to time, and started to build it into something that's more consistent. Some stakeholders talk about a night and day experience, and all of a sudden this now has a resource and a way of delivering. And I think that can allow us to build from strength to strength. And Colin, yourself and Sarah, and possibly many people on the call have seen me present on the population profiles and the future projections for Ireland. We have to ensure that we put the mechanisms in place to sustain sport and physical activity throughout life, especially with a growing number of older people in the population, and managing chronic illness through physical activity based in community settings. Certainly for us in Sport Ireland, and I know Una's very bought into this, and I know from working with the HSE and Department of Health, helping to manage those illnesses and reduce their prevalence through community-based sport and physical activity that is genuinely accessible to everybody, I think is one of the cornerstones into the future. But it does need to be resourced. It is resource heavy. And we are talking about engaging those who, some of whom are the least likely or hardest to engage. It's not as easy as setting up a club and people turn up and start taking part. There's a huge amount of, relationship building, trust, scaling up programs that are suitable to needs. All of that takes time and effort. And so it's great to see this pilot, reach this milestone. It's been in 6 LSPs. There's a strong evaluation. I think we don't try to sugarcoat the findings in Sport Ireland. We try to be as honest as we can with the science that is there. We're not pretending that this is some silver bullet that's going to solve all the woes, but we can see in the evaluation that this will make a significant contribution towards increasing physical activity rates of people with who experience a chronic illness, and that will improve their long-term health outcomes. And so we just need to build on that and, sensibly and strategically try to consider, can that be scaled? If it was scaled, how would it be scaled? How do we target it to get the best out of it?
Sure. Yeah. No, and I think that's very much the space these conversations are probably going to go in. I think as well, Blothin kind of touched on that challenge about, people's awareness of the challenge and then kind of what happens next. And I suppose if you think back to your gorge, and I suppose we kind of have a sense of the foundation of the bridges on the Sport Ireland side of the gorge. Sarah, if I can ask you from the HSE side of the gorge, what's your take on, I guess, how a process like this has enabled this initiative to come to life on the ground and what that means for the health sector?
Yeah, I suppose just a couple of things. I suppose definitely when you and Blothin showed the image there of our tiered model and the role of the health and social care professional in it. And I suppose very much, in health, what our staff can do, and we have the opportunity to do it thousands of times a day, is to raise the issue of physical activity, bring up the topic in conversation, share the health benefits of being active, and encourage or signpost to refer people out to opportunities, and now also to the Get Active program, which is a HSE offering, but within that 10-week program we are also encouraging people and signposting people to start with us, but then connect into what is already there in their communities to keep them going. But I suppose I suppose one of the things that we've consistently heard whenever any research is done, and I suppose the most recent research around it would have been done through the Physical Activity Chronic Conditions initiative, which again was an initiative led by three local sports partnerships, Carlow, Westmeath and Waterford, funded through the Dormant Accounts funding via Sport Ireland, and the HSE was a partner in that as well. But one of the key things that we heard through that when we spoke to clinicians and healthcare professionals in terms of like, what's the barriers for them around connecting people out? And it's, well, I don't know who is there. I don't know what is available. And I'm not sure that they know what they'll be doing, particularly with people with chronic disease and whatever. So that kind of wariness. But yet we know, and those health professionals were able to tell us very clearly that they would refer and were referring where they knew who they were referring to, and they had confidence in that. So it's like, kind of, how do you kind of move from that individual relational piece to kind of a more systemic trust, or generate that trust? Because as Benny said, like, this is a population piece we need to do. So we need to be getting a bigger group of people going and moving. And I think that's one of the real values of the physical activity for health officer role, is that as Eamon was saying there, the work at the beginning around building relationships, building trust, building knowledge, but also they would have done a lot of work around looking at the tutor exercise tutor population that they were working with, connecting them with additional training opportunities, looking at programs that they were already running within the LSP sector, and identifying ones that were really suitable for people to come on board, and then having those conversations with health colleagues as well to build that trust. And the physical activity, like the when we think about the population shift that we're trying to achieve, the physical activity for health officer initiative is really important and really, really critical. And will be great. Every time I speak to my colleagues about it, I keep getting asked, when are we getting one? When are we getting one? So it will be great to, to see I suppose, a policy commitment on foot of this evaluation to expanding it. Obviously, it's not something that can be done in one fell swoop, but over time, it would be great to see that. But there's other work going on as well. For example, the competency accreditation and qualification framework, which is about working with the academic bodies and training institutes that train our exercise professional workforce to, ensure that there's a broad competency and accredited competence there for working with people working with chronic conditions, which gives the LSPs a greater network of exercise professionals and tutors to draw on when they're delivering programs, but also, it creates a wider capacity within the community, so that people don't necessarily always have to come through PAFO or health, but that within our broad community, we're much more accessible and supportive. Because ultimately, I think at the moment, we've something like 1 in 3 adults over 55 are living with a chronic disease of some sort. And as you move up through the age ranges there, it gets more, and you end up with more chronic disease as well. So, just from that whole population health perspective, we know that our population is growing overall, but also the section of our population that's growing the most is people age 65 plus.
Yeah, no, that's very true. And I think, this kind of sits as one of the tools at our disposal, I suppose, to try and, do what we can to, maximize the health of that population cohort and the benefits that come from that. I think you touched on as well, I guess, how that evolution has gone to date, and where the conversations we need to start having on where it needs to go next. But, If we were to look, I suppose, at the evaluation itself, are there any particular takeaways or real, I guess, guides to that conversation about what we might need to take from it in that space? I might start with you, Benny, and get your thoughts on that.
Yeah, I mean, one of the things, and credit to Eamon and the team in S3, I think they did a really nice piece of work in capturing something that is relatively complex. Something that jumps out, if you consider it, is that only one of the 5 stages actually involves a physical activity program, right? Or 6 stages, right? The other 5 stages are around the physical activity program. And I was at a conference a couple of weeks ago, and I found myself, and I'm not sure it's the best analogy, but it can help to make a point. I found myself comparing sport and physical activity to a vaccine. And we know that vaccine helps to reduce the prevalence of coronary heart disease, diabetes, dementia, depression, different types of cancer, etc. So the vaccine is well established, and the program is kind of the vaccine. If you can get people to engage with this program, you get all these protective factors across all sorts of health outcomes. We're now kind of shifted into vaccine adoption space, and that's much messier, right? Because you have a complication of logistics. How do you get this out to the entire population? How do you scale this with sufficient logistical support that you scale beyond 4,000 people to 40,000 or 400,000 people who are engaging in this on a regular basis? And then in the vaccine adoption space, if we stick with that analogy, despite its challenges, but if we stick with it for a moment, you don't have to take this vaccine just once. You're going to take it multiple times every single week, right? And it's not quite like a vaccine because it's nice and it's enjoyable and it's social and there's loads of benefits to it, but it does come at a cost, right? It does come at an energy cost, and it does come at a time cost, and at times it'll also come with a financial cost. And so I think that's the space that we're in now. Is okay. We're out of the world of clear kind of clinical science, and now we're into this messy world of social science, adoption, Blauhin mentioned earlier on, behavioral change. This is difficult stuff. When at the conference I mentioned that analogy a couple of weeks ago, there was a woman there who was a professor on an MBA program, and she was brilliant. She put her hand up and she said, "You've got a business problem. This isn't a sport and physical activity. This is a logistic business, costs, efficiencies." And I thought that was a really interesting insight. We hadn't really thought of it in that way before. In terms of maybe bringing in some of that expertise to consider some of these challenges that we face as we try to, enhance the benefits, but also scale the benefits so more people can get an advantage of them. One thing that I thought was really nice in the report, and I talked to the team quite a bit about it, was I think there's an anecdote in there about the difference between passive recruitment and active recruitment. And I think that's worth highlighting because people on the call might find this a useful insight. The report found a difference in engagement levels if a healthcare professional is working with a patient and says, here's a contact detail for a PAFO or a website that you can visit to find out about sport and physical activity. The level of conversion there to actually follow through, to go and take part in an opportunity is lower than if the relationship is reversed. And there's GDPR pieces here to consider and all the rest. But if the conversation is more, do you mind if I share your contact details with a physical activity health officer or some other kind of resource, and they'll get in touch with you, right? Because then it's somebody who picks up the phone and calls you, "Hey, Colin, how are you getting on? I got your number from Sarah. How are you keeping? What's going on in your world? Look, Sarah said you might be interested in taking on some more physical activity. What activities have you done in the past? Maybe I can help you find something locally. Would you like to come even sit down for a cup of tea and I'll help you talk through some stuff?" Like all of a sudden you realise that's marketing and connection and social connection and human connection. There's stuff like that I think we need to better understand. Is actually what are the mechanisms whereby we can optimize that transfer rate. So I think they're the next phases, scaling and optimization. And always considerate of just the human resource burden that this implies. In our world, this puts human resource into local sports partnerships, and try to manage that as well is also a big part of the challenges.
Sure. Yeah. No, thanks. There's a lot to digest in that. Sarah, any thoughts yourself?
And I would agree with all that Benny has called out there. And I think the other piece for us to do is and often we look at those pieces with a very narrow focus, but we need to look at the landscape we need to look at that. So the Physical Activity for Health Officer Initiative, really important. Absolutely want one in every local sports partnership in the country. But they're only part of the answer. They're not the silver bullet. There's other stuff around, and we need to make sure that all that joining up is done. Interestingly, Benny, what you were talking about there, that kind of difference in conversion between how the conversation happens. The last time I was at HEPA, which is 2 years ago, the conversation and the healthcare subgroup or working group within HEPA as well, the messages coming through there, or the findings coming through there, that it's not really important what activity or what exercise program people get involved in. It's the fact that they get involved, and actually what they're saying, there's this whole piece around exercise referral in healthcare and funded exercise referral and all of that. But what they're talking about more is a physical activity counselling. So it's the opportunity to take what is our brief intervention now, which is where our healthcare professionals take a small amount of time out of a routine consultation to have an initial conversation. But it's because of time, etc. It's probably a very light enough conversation. We know it has impact. Like Nisa said, that like one conversation, brief intervention from a GP, 12% of patients will become more active. At a population level, that's a massive shift and a big number. But the opportunity for that kind of longer consultation counts, just that opportunity to have what you described there, Benny, will probably give a better conversion. And we see that with our quit smoking services, and in some ways our Get Active program, we're trying to model it on that. So there's still a way to go. The PAFO and the Physical Activity for Health initiative is a critical part of our national jigsaw, I think now, and I think there are lots of other conversations to have to get that, as I said, that policy commitment to it as a priority for resourcing and investment and rollout, and then the great thing about the evaluation is there is now a clear roadmap for any new posts or initiatives to follow. And, that roadmap makes it really clear and highlights the importance of the time taken to build those relationships, build that trust, that connections, because very often, and fair play to Louise in Sport Ireland, who was leading out the work when the PAFOs first came into place, around like really holding back on that. We need numbers to the actual. This is about relationships and giving people the time to build those relationships. So yeah, I think it's only going to go from strength to strength, really, and I think we have a fantastic foundation.
Yeah, no, thanks very much. That's a point well made. I think it is one of a series of jigsaw pieces that I think we need to just start picking them all up and having a good look at them. But I'm not going to apologize for the fact that we've run over, because I think this has been a really interesting webinar. I want to say a huge thanks to Benny and Sarah for your insights there, obviously to the other participants during the course of the morning, and to the ministers for their addresses. And obviously, huge thanks to the audience for sticking around. I hope you found it useful. We'll close it out from there. So good afternoon, everybody, and thanks again.
Physical activity guidelines for people living with a disability. Staying active is important for adults living with a disability. Regular physical activity can boost your health, improve your mood, and increase your independence. Ireland's physical activity guidelines for people living with a disability include moderate intensity aerobic activity such as walking, running, cycling, and swimming. Muscle strengthening exercises at least 2 days a week. And limiting sedentary behaviour. You should do 2 hours and 30 minutes of moderate intensity aerobic activity each week. Moderate intensity activity is when your breathing and heart rate increase, but you can still talk. Muscle strengthening exercises can include Pilates, yoga, exercise classes, gardening. It's important to include activities that improve your balance and strength. This helps you to move safely and avoid falls. It's also important to limit your sedentary behaviour. Replacing time spent sitting down with any form of physical activity benefits your health. Move your body and be active in ways that you enjoy. Any physical activity is good physical activity. If you are not able to stand, you can stay active with upper body exercises or wheelchair-friendly activities. Being active is for everyone, no matter what your ability. Every move counts.